The highest quality product, professionalism, integrity, relentless attention to detail, like family. This is how clients most often describe Batten Shaw Construction. Since 1988, Nashville-based Batten Shaw has excelled in high-quality construction of healthcare facilities across the United States. Their depth of experience in this arena makes them uniquely qualified to manage the complexities of healthcare construction projects.
When I think of Batten Shaw, I think first and foremost quality product. The output that they have on the end result is always exceptional. Secondly, I think professionalism comes to mind. Particularly when you're working in a hospital setting, it is so important to be aware and conscious of working around patients and being the least disruptive that you possibly can. And Batten Shaw is always very instrumental in making sure that that happens.
Building a brand new building unoccupied out in the middle of a field is a whole lot easier than what we do. When you do something that not everybody is experienced enough to do, such as dealing with medical gases and all the complicated systems that go along with hospital care, when you're trying to do construction on one side of a wall and they're operating on people on the other side of the wall, you have to have a great knowledge of how to keep all the systems going and how to keep the people safe.
The scope of our current project that we're under runs about 3 years. The first thing that we were able to bring online with this project was our birth center, which we're sitting in here today, and our neonatal intensive care unit. We are the only NICU north of downtown Nashville. So that affords our families here in our community to stay with their baby and not have to travel miles and miles when their baby needs some extra care. Our helipad had to move when we did the birth center, so it's set here right where we're sitting today. You wouldn't think that a helipad would be that difficult. It's a piece of concrete, but it really is pretty complicated. They had to position that literally between buildings, and you have to have FAA approval, and it really is a pretty big deal, as you can imagine, to be able to have helicopters land safely. And so they worked diligently to make sure that that was state of the art and right outside the ER door.
This project was something very different and very unique to what our architects and what our company has ever done before. We are a complete senior living campus in which we house both assisted living apartments, folks with early stage Alzheimer's, dementia. We have a secure memory care, skilled nursing unit that also takes care of folks for short-term rehab as well as folks that need continuing care. We are a geothermal campus as well, so we also had to dig about 166 wells over 500 feet deep to get ready for a geothermal heating and cooling system. Batten Shaw were exceptional at seeing that vision and taking hold of it and making sure every detail was to our satisfaction. You could tell that the end result was important to them. It wasn't just about building a building and getting paid.
The more you understand about the project, the better the budget's going to be. In the instance of 100 Oaks, for instance, it was 277,000 square feet. They wanted us to demo it and build it back in 7 months without any drawings. Yet a budget had been given, and we did complete that job in 7 months, and it ended up being 440,000 square feet and a $40 million project. They were so happy with the work.
I can't tell you the number of times that they would come to me and say, I wanted you to see this, I'm not satisfied with it, and I don't want you to be satisfied with it. I'm going to tear this out and do it again because I think it can be done better. We couldn't be in a better city than Gallatin, and we couldn't work with a better builder than Batten Shaw. And here we sit today, a 120,000 square foot building that's state of the art and is a great resource to the people of Sumner County.
It is very rewarding to finish those jobs and walk away and you've got a sparkling new facility, nobody's gotten hurt, and that facility is able to deliver more and more patient care.
As you go through projects, particularly in a hospital setting, it's always going to be the case that you're going to have to change things up. They've always been very willing and very open to making changes and making sure that in the end, our vision for that project is what we want it to be.